wonderful day to you. Welcome to your top health management program here on our station. We're here to bring you good information that is bringing healthcare beyond your doorstep to the very place where you are. That is where we are bringing it today. And today we'll be looking at a very, what I call it dynamic health challenge. Yes, dynamic in the sense that it could cripple you financially, medically, as well as emotionally. And moreover, it affects everything about you, everyone about you. What are we looking at today? We are looking at stroke management. And I have in the house Dr. Yusuf Yakob. He's a consultant neurologist. Yes, he's from the Department of Internal Medicine, Federal Medical Center. Dr. Yusuf,
good morning. Good to have you too.
All
good
right.
to be here.
Yeah, it's good to be here. Good to know that you're here. You're looking very well, so I can say.
Thank you. And you too.
Internally, it shows that you're taking care of yourself.
Thank you so much.
Okay, so now we're looking at a stroke. Like I said earlier, it's one medical dynamic challenge that I've come to see that affects every sector of life, society, both finances, medically, socially, everything about you. Once you come down with stroke, everything just seems to like be down.
Yeah.
Okay, so now, but someone out there might just be wondering, why is it dynamic? What is special about stroke? So let's get from the medical angle, what is the definition of stroke?
Wow, thank you so much. Before I delved into the definition, it is important for us to understand the magnitude of this stroke generally.
Okay.
And stroke is actually a common neurological disorder. And the funny thing is that it has significant impact on individual life and quality of life. And it is associated with high morbidity and mortality in the patient. And in fact, it has been said that stroke is one of the leading causes of death and disability worldwide. And I'm also shocked you that WHO reported that we have 15 million new cases of stroke yearly worldwide, and of these 5 million die and other 5 million will be permanently disabled. Now let's now talk about stroke. In a layman's language, when we use the word stroke, it is not a spiritual attack. It simply means there is a disturbance in the brain function. And the WHO now define stroke as what we call a clinical syndrome that is caused by focal brain disorder,
Okay.
leading to death or lasting more than 24 hours in the absence of any other causes other than vascular. And that is the definition by the World Health Organization. But for the lay people outside there, stroke simply means a disturbance in the brain function.
Okay, so it's not about your village people coming
It is
after
not
you.
your village people. It is not an arrow.
It's not an arrow.
They did not
Because
call
I'm
your
sure-
name in the dream.
I'm sure you have heard that often.
We've had more than enough.
Enough of
Yes,
it.
and that is why it is our duty to keep reorienting people for them
That
to
is
know.
not your village people
Yes.
looking for you. Nobody shot an arrow.
Nobody shot
But
an
it's
arrow.
a disturbance to
in
the
the
brain.
brain function.
So it is the brain that actually could paralyze the arm.
Brilliant.
What is the link? The brain, the arm, the brain, the leg.
Everything about us is in the brain. The brain controls everything about you. Your ability to see me is part of the function of the brain. There's the area in your brain that is responsible for your vision, that sends information to your eye, that sees somebody sitting down here. So as much as you have your eye, if you touch that part of the brain, you will not see. There's also the part of the brain that is responsible in coordinating the function of your limb, the way you control your eye movements, the way you talk. So when there's a problem in this part of the body, it will not send information to the area that needs it, that's supposed to function. So if there's a disturbance in the area of the brain that coordinates the limb function, even though you have the hand will not function because they are not getting information.
So just like the heart, the brain is the engine room of the human embodiment.
Absolutely.
And when one part of it that relates to any particular part is malfunctioning, it will actually give us stroke to related to that body part.
Brilliant.
Ah. Okay, I almost would have said, let me clap for myself. At least I am following. Okay, now that we understand the definition of stroke, I believe there are types, because I've heard the word partial, and that's the commonest that I've heard. But are there other types of stroke?
Okay, very good. So, when a patient has a stroke, the first thing the doctor would like to know is, does this patient really have a stroke? If the answer is confirmed that it is a stroke, then the next thing is, what kind of stroke does this patient have? Because the type of stroke determines the line of your treatment. So, I will also come from a layman's point so that people will understand.
Better for me.
I use the concept of a pipe theory.
Pipe. Okay.
You know, in a pipe, there is a lumen through which water can flow easily.
Yes.
And that lumen is actually the blood vessels that carries blood within the brain. When there's anything that disturbs the function of that pipe, it is what we call stroke.
If it comprises, if it's blocked.
Very good. But anything that disturbs the flow of water through the pipe is called a stroke in the brain. But two things can happen to the pipe.
Okay.
Is either the pipe blocked or the pipe burst. When you have blocked pipe, it is what we call medically an ischemic stroke.
Okay.
That is when you hear us saying the patient have an ischemic stroke. The word block does not mean that the whole of the blood pipe is blocked. But when there is a little block, it affects the flow of blood. And that will also affect the communication to the part of the body. And when there is a burst in the pipe, that is what we regard to as hemorrhagic stroke. So basically, we have two types of stroke. And this one is ischemic stroke, and the other one is hemorrhagic stroke.
Hemorrhagic. So why do you always hear the word partial or total stroke? Where did that come from?
Okay, so again, too, people misuse that word. When a patient have a stroke and they recover, you start hearing the word partial stroke.
Okay.
But that is not
the medical kind of line of defining it. Okay, so now you know that recovery is what we generally refer to as the partial stroke in our own layman's. But medically, you have the what is it called again?
Ischemic, which is the blocked pipe.
The blocks.
When the pipe rupture, it is hemorrhagic.
It's hemorrhagic. Okay, hemorrhagic, I know that has to do with blood, as
Very
in
good,
that
yes.
spilling. Yeah. Okay, now we know the definition of stroke. We now also understand the kinds that is manic, and then we have the hemorrhage, the blood one. Okay, now let's look what actually causes this, because since the brain is the engine room that controls every part of the body, and if something happens to it, then the body part that is affected is where the stroke hits. So now, what gives us this stroke? What causes it? Is it what I eat, what I do, or how I do?
All right, so let's look at it. Basically, we use the word risk factor because there's no one thing that you can unpick. So when you see, what I mean is that patient could have multiple risk factor, meaning that patient may be hypertensive, but it's not only hypertension that is responsible for that stroke.
Okay.
So basically, when you say risk factor for strokes, there are two angles. There's what we call the non-modifiable and the modifiable. Those are the things that we look out for when a patient comes down with stroke in the hospital. What do we mean by non-modifiable? It means that there is nothing you can do about it. It's by virtue of some genetic makeup. Number one, it has been shown that male gender are more at risk of a stroke. Not that the female cannot have it, but before the age of before menopause, male are more at risk of a stroke. But as soon as women attain the age of menopause, they lost the protective effect of their menstrual flow, which we call the estrogen. And because of that...
So that's a protection for being a woman.
A protection for being a woman. So that is number one. Number two, again, is race. It has also been shown that black are more at risk of stroke. And not only that, people who have family history of stroke, they can also come down with a stroke. So these are some of the risk factors that we consider as the non-modifiable risk factor.
Okay.
Now let's now come to the modifiable, which means that something that we must consciously look out for and do something about. Number one is hypertension. When somebody is hypertensive and is not well controlled, that person stands at risk of having a stroke. Number two, diabetes mellitus. Somebody who is diabetic, not aware or aware but not taking drugs, the person is at risk of developing a stroke. Number three is what we call other cardiac diseases. And that is why it is important for you to see a doctor to evaluate you, because there are some cardiac diseases that we call atrial fibrillation and many more that could also put the person at risk of developing a stroke.
The doctor comes to analyze or check on me before the stroke or after the stroke. Now, when I suspect there is a stroke.
These are what we call.
Because in this country we don't really on our own go for physicals.
Yeah. So now there are two categories of people: those who have not developed stroke. When you have not developed stroke, it is the duty to look out for all these risk factors, so that to prevent you from developing a stroke. Number two are those who have developed stroke. You need to still find out what led to the stroke, because one stroke leads to another. Because if you have had a stroke,
one stroke
leads to another
stroke.
So if you recover from that stroke, the risk of having another stroke is also there. Okay. So you must identify the risk factor and manage it well. And that is why we call it the modifiable. So you must look out for them. Is this patient hypertensive? You will evaluate for that. Is there diabetes? Is this patient obese? Obesity is a risk factor for stroke. What's alcohol? People who take alcohol a lot, they are also at risk of stroke. Then cigarette smoking and substance abuse. You know that in our society now, illicit drug use is now almost the order of the day.
It's a trend.
And these things has been shown to affect the brain, and it can lead to stroke. Now, of course, there are other causes like a sickle cell anemia. They are quite numerous. So it is now the duty of the doctors to look out for the risk factor so that we're able to help the patient management and outcome.
All right, now if you're just joining us, I have Dr. Yusuf Yakub, who is a neurologist, consultant neurologist from the Federal Medical Center here in Asaba. We're looking at stroke management, and he has also come to demystify the fact that it is not your village people after you that makes you have a stroke. It's a malfunctioning of the brain. If you are able to access medication on time, then you may have what we say is a partial stroke because you are able to be managed. But if you are not able to be managed, then in our own language, it becomes a total stroke, because the medical one, the hemorrhagic, I leave it for Dr. Yusuf to hold on to. Okay, now we know too that the way we live can actually make us have a stroke. It's either if you already have an existing medical situation like being hypertensive, being diabetic, you're on the big side, you're already obese, you're not controlling what you take in, you just want to take in everything, no problem, you become obese, then you have a very high risk factor of coming down with a stroke. Then if you're also trending with smoking, indulging in substance abuse, or taking so much alcohol, there is also a very high chance that you may come down with a stroke. Okay, now Dr. Yusuf, now let's also move on to clinically, because we usually leave the clinical for the doctors, but at home there are these telltale signs. This could be a stroke. Everything is not just stroke, right?
Yes.
I could actually have a cramp, and if it stays more than 24 hours, would I assume that's a stroke? I don't want to assume that. Okay, so now let's look at this clinical way of recognizing the features of a stroke.
All right. Okay, so again too is that we have tried to make things easy for people out there. First thing you must look out for is the onset of the symptoms. Meaning that somebody who has been very fine, okay, and tells you that the symptoms happen suddenly. And then what are now the symptoms that we are looking out for?
Yes.
For us to understand, let us always remember, be fast. Be fast. B-E-F-A-S-T.
Be fast.
That is the starting point for everyone watching this. The B stands for balance. It means that somebody who has been fine, all of a sudden, the person cannot walk well. Start having a staggering gait, losing his balance. Such a person should be taken to the hospital immediately, because there's something going on. Number 2, the E stands for eye. All of a sudden, somebody just tell you that I cannot see again.
Not that the person is blind.
Not that the person, all of a sudden, there is what we call sudden blindness without any trauma to the eye. Somebody is interacting, could not see, or slept last night, woke up with inability to sleep. The duty of the people around is to take the person to the hospital for immediate evaluation. The F stands for the face. You look at the face of somebody that you are interacting with, and you notice that the face drifted to one side, which we call facial deviation. Once you observe any facial deviation, you rush to the hospital. And the A stands for the arm. Somebody, all of a sudden, the person could not stretch forth his hand as a result of weakness. So there is a weakness on one side of the body.
Okay.
Such a patient could be experiencing the clinical features of stroke. And what does the S stands for? The S stands for speech. The person observed that a person that has been talking freely just started stuttering and stammering,
Okay,
having what we call slow speech or sudden inability to talk. Then you must suspect that something is going on in the brain. And the T is actually the most important, which is time.
Time.
It means that time is brain, time is neurons, time to rush to the hospital.
Time is brain.
Yes, time is neurons.
Okay.
Because for every time lost, every time that you are wasting, you are killing more neurons in the brain. So those are the one that you need to know. However, there are now some features outside this be fast. Number 1 is, you may notice that somebody who has been very fine, all of a sudden in the office, start behaving irrationally. Sudden onset of irrational behavior. Such as scattering things.
Like having
that looks like he has a mental disturbance. Sudden onset. He has never experienced that before. Please let the person go to the hospital for immediate evaluation, because that could also be a stroke.
Not
now,
like mental
yes,
disorder.
because there is a part of the brain that controls your behavior, and when there's a compromise in the flow of blood to that area, the person tends to manifest like that. Or somebody develop a sudden onset of difficulty in swallowing, then it could also be a stroke.
Okay, so now in recognizing the clinical features of stroke, doctor have given us the new acronym, Be Fast, and that means watch out for balance, check if there's sudden blindness, if there's this facial deviation, like the face is shifting, okay, then the arm, you cannot move it, it's weak, then the speech becomes slurry. Somebody who can't speak perfectly, it's not like the tongue is being swollen up and can't speak well eloquently anymore. Time is of essential here, because the time is brain, and the more time we waste, the more neurons you kill. Now, watch out for the new addition a sudden mental disorder. We have been looking at a stroke management. I still have Dr. Yusuf Yakub in the house, who is a consultant neurologist from the Federal Medical Center. We'll take a break now. When we come back, we'll look at other important aspects of stroke management. Stay with us. It's the program Your Health. We have a Dr. Yusuf Yakub, who is a consultant neurologist in the house, and we're looking at the management of stroke. So far, we've looked at the definition, we've looked at the causes, we've also gone through recognizing the clinical features of stroke, and the acronym BFAST came in. Watch out for balance, watch out for eye sudden blindness, and look out for facial deviation, that if the face is shifting, and then if you're having a slurry speech as well as the arm weakness, and of all time, it's very essential. Doctor, still there? Okay.
Yes, still there.
So after now you're going to clap for
no, you are doing very well. Thank you so much for the beautiful recap.
Okay, so now let's quickly look at the pillars of care in managing a stroke. Now we identify those things that we have to look out for. Now, if it happens, what are the pillars for care?
All right, thank you very much. So let's just run. When a patient develops a stroke, or perhaps when you suspect a stroke, because it's still a suspect, you are not yet sure, the first thing you need to do is, having this knowledge of what we have said, rush to the hospital. And when you get to the hospital, the aim is to work within your time frame. And the first thing in the pillars of care is confirm the diagnosis and know what kind of stroke. And how do you do that? First is quick examination of the patient, and we always do an imaging of the brain. So all patients with a CT scan, with a brain with stroke, must have a CT scan in order for you to know what is going on and the type of stroke that they have developed. Now the next pillars of care is, if you think the patient have a blocked pipe stroke, you need to timely recanalization, meaning that a pipe that has been blocked, you need to timely open up the pipe so that you can allow the flow of blood within the brain. However, this is time bound. It means that the patient must get to the hospital and get the CT scan done within 4 hours 30 minutes
of occurrence.
Outside this time, the person will miss that recanalization with the medication. However, the issue again is that the medication in achieving that is not readily available. And the drugs that we often use is actually what we call the tissue plasminogen, which we often know as Ortiplas. But the drug is very expensive, because how many people can afford it is in millions.
Is in millions?
Yeah.
Okay.
So the second other aspect of the pillar of care is, now we try to improve the flow of blood to the brain. We try to do what we call secondary stroke prevention, which we do as a neurologist in the hospital.
Okay. All right.
The other one is we rehabilitate the patient, then we treat any complications that has happened.
Okay. Based on rehabilitation and treatment, now, is stroke preventable at all? Let's not get to treating. Can we prevent?
That is why we are here.
Okay, so please.
Stroke is preventable. Then the next thing, what are the healthcare measures to prevent stroke? Number one is regular physical exercise. I encourage everyone physical exercise.
Okay.
Number two, again, is consumption of fruits and leafy vegetable, which is very good. Also, reduction in the consumption of what we call the refined food. You must also try as much as possible to reduce the consumption of alcohol beverages. Then cessation of cigarette smoking and any forms of illicit drug use. And don't forget again is that regular medical checkup is essential for you to know your blood pressure, your lipid number, and also your blood sugar number. And lastly is your adherence to your medication for those who have any of all these risk factors.
Thank you so much, Dr. Yusuf. He is a consultant and neurologist, and I will be looking at stroke management. But don't worry, we're about to take a bow for today. But next time, we'll be here to throw more light. Thank you so much, Dr.
Thank you so much. You can still come and join us. We'll be glad to receive you.
Okay, we'll call you back again to come enlighten us more. I will also say big thank you to the Nigerian Medical Association, Asaba Zone. On this note, we say take care of yourself. Remember, avoid what can be prevented. No abuse of substance drug, no excessive alcohol. Just eat well. Leafy vegetables, very good for you. Clean water and exercise. Until we meet again, take good care of yourself. Service.